Welcome. Today's presentation will cover a topic that many people have experienced, yet we're unsure what it is called. Moral distress affects almost everyone at some point, and hopefully by the end of the presentation, you will have the skills to recognize and combat the detrimental effects. Nursing care and patient outcomes are extremely important in today's complex healthcare environment. Numerous studies have shown an association between poor patient outcomes and nurse turnover. As such, it is important to decrease nurse turnover. Unresolved moral distress has been associated with increased nurse turnover. Therefore, moral distress is an important topic for nurse leaders to understand and address. Historically, at Bayshore Community Hospital, the nurse turnover rate has been the highest in the Meridian Hospital system. At the end of 2014, Bayshore had a turnover rate of 12.12%. At this time, turnover has decreased to 9.35%, a marked decrease, but still the highest in the system. System-wide, RNs have all been given a market adjustment raise to increase retention. The amount of compensation for higher degrees and national certifications has also increased. Even with the financial compensation, Bayshore continues to have a turnover above Meridian's set benchmark. New ideas need to be considered. Bayshore's nursing staff is also relatively young, with many new RNs. New graduates are associated with higher levels of moral distress. To correlate nurse turnover with poor patient outcomes, I will look to Bayshore's CLABSI rates. Bayshore is the only hospital within Meridian Health that has an unfavorable CLABSI rate. On Meridian's magnet document, it is noted that Bayshore has only performed favorably on two of the 5 nursing units as per NDNQI standards. So where do we go from here? It's been identified that Bayshore is plagued by high turnover rates, which leads to a higher moral distress, and newer graduates are also associated with high moral distress. Therefore, focusing on the decrease of moral distress can help Bayshore decrease nurse turnover and ultimately improve patient outcomes. The first step towards decreasing moral distress, or the ill effects of such, is to understand moral distress. Andrew Jamestown first coined the term in 1984, and he defined moral distress as knowing the right thing to do, but institutional constraints make it nearly impossible to pursue the right course of action. Moral distress is distinct from other types of stress because it specifically violates a person's core moral values, leading to a loss of personal integrity. Moral residue can occur when moral distress is not addressed and a lingering feeling remains. The problem with the moral residue is that it can create what some researchers call the crescendo effect, where the level of moral distress never completely dissipates, so that each new situation builds on the already elevated level of moral distress, creating stronger reactions to the stressful situations. In order to combat moral distress and moral residue, many researchers believe nurses need to be empowered through educational programs and facilitated discussions to become morally courageous and develop moral resilience. Moral courage is considered to be the opposite of moral distress, where the individual has developed the capacity to overcome the fear of reprisal for standing up for what they believe to be morally right. Helping nurses to see moral distress as a starting point for moral courage can also help to prevent moral residue and instead lead to moral resilience. When a nurse develops moral resilience, the nurse has both the ability and willingness to take the right action. Different causes of moral distress are often related to nurses' work environment. For example, the most common reason identified for critical care nurses to experience moral distress is futile, life-sustaining treatments. Pediatric nurses experience moral distress when they believe the best interest of the patient is not being served. Oncology nurses experience moral distress when they perceive that the informed consent process is compromised, or the patient's quality of life will suffer. Palliative and hospice nurses experience moral distress when decision-making shifts from the patient to a family member or other surrogate. It's important that nurses have some understanding of what can cause moral distress so that they can recognize the feelings that are evoked during these morally distressing situations. For individual nurses, moral distress can have many effects. Frustration, anger, and guilt are three of the most verbalized issues. When moral distress continues and is not addressed, this leads to moral residue, as previously discussed. The effects of moral residue begin a disintegration of an individual's moral integrity. Long-term moral distress produces a myriad of harmful consequences. Emotional consequences include a feeling of powerlessness, overwhelming fear, anxiety, depression, all leading towards burnout. Spiritual consequences of moral distress include dampened moral sensitivity, loss of self-worth, disruption of faith, and a disconnection from work. Physical effects of moral distress include heart palpitations, insomnia, fatigue, and a low resistance to infection. Behavioral consequences of moral distress include impaired thinking, addictive behavior, and coworker violence. All of these individual consequences lead to other team and patient issues, such as teamwork erosion, decreased quality of patient care, coercion of patients, longer hospital stays, and poor overall patient outcomes. Research is abundant on different interventions for moral distress. Professor Arthur Frank, when testifying before the Presidential Council on Bioethics regarding recovering caregivers, developed 13 provisional behaviors. These behaviors can be used as tools of reflection to begin the educational instruction for combating moral distress. Arthur Frank offered these 13 steps to be shared freely when he testified in front of the committee. Education has been promoted as the foundation for all interventions for decreasing moral distress. The Journal of Nursing Administration proposed that integration of ethics into a clinical residency program would help to fill the educational void in most associate's and bachelor's educational programs. The University of Kentucky developed a free 2-hour program called the Moral Distress Education Project to help nurses understand and combat moral distress. The free program can be accessed by typing in the web address on the screen. The 4 A's to Rise Above Moral Distress was developed by the American Association of Critical Care Nurses. Another step towards combating moral distress is to determine what level of moral distress nurses are experiencing in the first place. The Moral Distress Scale Revised is a tool designed to collect data regarding the moral distress currently experienced by staff. Debriefing sessions are beneficial for many ethical reasons. A debriefing session is an explicit discussion focusing on morally distressing situations with no judgment of right or wrong actions taken, also known as facilitated ethics rounds. Schwartz Center rounds are a nationally recognized platform for these types of discussions. Another benefit of a facilitated debriefing is that it allows nurses to explore their peers' methods for dealing with morally distressing situations. Team building activities are also an important step in combating moral distress. Improved communication and trust are two of the important outcomes of team building to decrease moral distress. The overall budgetary needs are relatively minor in consideration of the benefits. Many of the educational offerings are free, such as the Moral Distress Education Project. Other educational offerings can be accessed through the online database of Meridian Health. An incentive for nurses to take part in the education would be to pay them for the hours spent during the educational activity. Meals are also incentives for nurses to participate in activities. Guest speakers with national recognition could pique the interest of nurses as well. In order to determine if the suggested interventions are effective, the best way to evaluate would be to conduct a pre-intervention and post-intervention questionnaire. The post-intervention questionnaires will be compared with the baseline questionnaires to determine if there has been a decrease in moral distress. Surveys can also be given after debriefing for a subjective reflection on the sessions. Well, I thank you for your participation, and it's my desire that these interventions will ultimately provide an improvement in patient outcomes by increasing nurse retention.